Hello, my name is Julia, and this is my presentation on pharmacogenomics. So what are pharmacogenomics? It's the study of the role of the genome in drug response, which means it analyzes how the genetic makeup of an individual affects their response to certain drugs. This started in 510 BC when Pythagoras noted how some people have reactions to eating fava beans, and the people who showed a reaction also had hemolytic anemia. And people who have hemolytic anemia and consume the fava beans often get symptoms such as tiredness, dark urine, yellow skin, and shortness of breath. In the 1950s, this was recognized and called favism. This is important because, like fava beans, certain people with certain conditions can have adverse reaction to some drugs today. And pharmacists can use a patient's genotype or genetics to help prescribe the correct medication to them. So the laws regarding genomics of pharmacy. So the first FDA-approved pharmacogenomic test was in 2005, and this test approved testing of alleles in genes CYP2C9 and CYP2C19. The CYP2C9 affects the metabolism of ibuprofen and other NSAID pain relievers, and the CYP2C19 affects the metabolism of some antidepressants, sedatives, and proton pump inhibitors. The CYP2C9 and CYP2C19 genes are the two most common drug metabolizing enzymes in the body, accounting for 70 to 90% of drug metabolism. The restrictions and regulations. So in 2015, President Obama unveiled the Precision Medicine Initiative, which would allow for personalized drug therapy. And in 2016, the following from the FDA was being considered for use of genetic testing. So tests that determine the risk of developing a condition, diagnose hereditary genetic disorders, and tests that can guide treatment or therapeutic interventions. These kinds of tests are what would be available to use in pharmacogenomics. And the FDA stated that therapeutic intervention is also the best way for pharmacists to have an impact. It shows that while pharmacogenomics is available, there are some restrictions onto what can be used for testing. The role of the pharmacist and the pharmacy technician in pharmacogenomics. So the role of the pharmacist while using genetic testing for their patients is to use knowledge of drugs to come up with an individualized plan for each of their patients. And of course, complying with HIPAA laws when working with patients and their doctors. This, of course, goes for the pharmacy technician as well. And this next quote is from pharmacist Candice Schuft in the article Pharmacogenomics and the Role of Pharmacists. So pharmacogenomics may result in a safer, faster, and more cost-effective drug therapies, potentially reducing the need for a long and inefficient trial and error method of prescribing medications. And pharmacists are essential in developing this technology. And these are my works cited. Thank you.